Hello and welcome to the third annual Completed Life Fall Conference, session 1 of day 2. My name is Sarah Kiskadden-Bechtel, Program Director for the Completed Life Initiative, and I will be your host today for today's session of the role of autonomy and conscience in a good death. Yesterday, you heard a rigorous discussion about the ethical, legal, and medical implications of removing a residency requirement for patients seeking assistance in dying, vis-a-vis Oregon's Gideons v. Brown et al. 2022, the first in the nation to successfully challenge a state's residency requirement. Yesterday in session 2, our panelists discussed at great length how the cultural, medical, and legal norms struggle to accept positive connotations about a chosen death, both in Canada and the United States, vis-a-vis the hashtag death positivity movement. Today's session will address how a person's conscience is often overlooked when evaluating personal autonomy. Cognitive capacity, that is, being of sound mind, is foremost on any evaluating provider's mind as they evaluate a person's ability to decide for themselves their own end-of-life decision-making, and to what extent these decisions reflect a so-called right to die. The role of personal conscience within decision-making therefore becomes muddied. Does conscience inherently derive from a person's chosen or inherited religious tradition? At what point does the person give themselves permission to choose an end-of-life plan that perhaps differs from what religious doctrine might emphasize? This session will examine the differences regarding what is permitted at the end of life, vis-a-vis state authority, medical authority, and cultural customs. For this session, I have the honor of welcoming Father Don Pachuta and Professor Paul Menzel to the Completed Life stage. Father Don Pachuta has taught scripture literally to thousands of people in adult formation and to teachers of religious education, as well as Catholic high school principals and administrators, and in a variety of Catholic and Protestant churches, synagogues, and in multiple states throughout the country. He graduated from the University of Buffalo School of Medicine, where he trained in internal medicine. He was Associate Professor of Medicine and Chairman of the Introduction to Clinical Ethics. Father Don has taught Catholic medical ethics in a variety of venues with the goal of clearing up the great deal of confusion and misconceptions about what constitutes Catholic teaching in ethics, especially as it applies to medical aid in dying. Father Don is still active in consulting for patients and physicians as well as in nursing homes and hospices. In all his writing, teaching, and preaching, he continually elevates and champions immigrants, the poor, and sick. He has studied the religions of the world and has integrated their spirituality into his teaching and into the core care of people of those religions and appeals to a wide audience. Dr. Paul Menzel taught philosophy at Pacific Lutheran University from 1971 to 2012, having been educated at Worcester, Yale, and Vanderbilt. Teaching widely in philosophy and cross-disciplinary curricula, he has also published specialized scholarly work in healthcare ethics, including 2 books on moral questions in healthcare economics, numerous articles on health system structure and healthcare reform, and a recently co-edited volume from 2012 on the tension between treatment and prevention in health policy. He has also served Pacific Lutheran University in various administrative positions, including provost. He retired as professor emeritus in summer 2012. Dr. Paul Menzel has published widely on moral questions in health economics, health policy, voluntarily stopping eating and drinking, and advanced directives for dementia. Professor Menzel is an esteemed founding member of Completed Life Initiative's steering committee. Whether you are new to our Completed Life community or are a returning attendee, these sessions are invaluable learning tools, and we are delighted for you to be here. I invite you to keep asking lots of questions as the conference continues. Before we begin, please be aware that you may input your questions into the Q&A feature located on the lower right-hand corner of your screen. Please feel free to submit questions throughout the event today, and later on we will turn to your questions for an interactive Q&A with our esteemed panelists. If you'd like assistance with closed captioning, you may toggle on the box located in the lower left-hand corner of your screen that provides captioning for the spoken words of our event today. And finally, the recording of today's event will be published after the conference concludes. Welcome, Father Don and Professor Paul Menzel. Welcome and good morning. I'm delighted to be here with both of you today. And welcome to all of you in the audience. Thank you so much for joining us. So notions about conscience go back many centuries. And Thomas Aquinas is a major philosopher and theologian. And Father Don will begin by opening with some remarks about Thomas Aquinas and conscience.
Yes, I'm not sure if it was mentioned in my bio, but I have a degree in philosophy, a bachelor's degree, and also enough credits for a master's, which they wouldn't give me because I wasn't registered in the graduate school. So I have that background in philosophy. So Thomas Aquinas is the core central philosopher of the Roman Catholic Church. And Thomas Aquinas said this: even an erring conscience binds. If there is something you believe you cannot do, after taking care to form your conscience, underline, taking care to form your own conscience, even if the church commands it, then you cannot do it. If there is something you believe you must do, even if the church forbids it, then you must do it. What the Roman Church did was they divorced themselves from that core definition of Aquinas and added this: you must have a properly formed conscience, and it must adhere to our teachings, dogmas, doctrines, etc., or it is not properly formed. So Aquinas said, you form your conscience. It's personal and individual and hopefully formed well. The church says, no, we form your conscience, and to have a properly informed conscience, you must believe X, Y, Z, what we teach. So John Henry Carter Newman was a famous person. Actually, they made him a saint. And he had a parenthesis: the whole split between the Catholic and Orthodox Church was based on one letter, the Greek iota, of where does the Spirit come through the Father and Son, or hadn't the Father and Son. Well, anyway, here's what I like. I shall drink to the Pope, if you please, still to conscience first and the Pope afterwards. And one of my favorite people, unfortunately, died too quickly, Albino Luciani, Pope John Paul I. Never be afraid to stand up for what is right, whether your adversary be your parent, your teacher, your peer, your politician, your preacher, your constitution, or even your God. Now, he didn't mean the real God, but the religious projection of God. So there are many, many quotes about following your basic conscience, not necessarily what a religion says you must follow, whether it's the Catholic religion or other religion. And Thomas's ethics, which we'll get to at some point, I'm sure, Thomas's ethics are still valid in the Catholic Church, just misunderstood or misquoted or mispreached, or however you want to say it. And so Thomas Aquinas is based on two things: free will and intention. So I'll leave it there.
Thank you, Father Don. And Paul, what are your thoughts on conscience and Thomas Aquinas, and what would you like to open with?
Often, well, always actually, conscience is in a context where something powerful is contrary to it, and an individual in their conscience says, I can't do that. That is what is required by some other authority, whether it be the state, the church, a king, the culture, whoever. Conscience is so important when it is persistent. In fact, I'm not sure I would call it conscience if it weren't persistent. That is, the person can't say to him or herself, I can do no other. I may try to get rid of this belief that puts me in opposition to some other powerful contrary force in my society, but I can't. And that persistence is very important to being an actual conscience. Now, I would call it a moral conscience, or but that, as Father Don has explained to me, is dangerous because usually the opponent of conscience is claiming to have moral authority, and so they put a claim on the moral beliefs of people, and then conscience, even if it is moral conscience, is standing up against that. And maybe a better term for conscience, my sense of moral conscience is just conscience or ethical conscience. Now, I think the fact that it's persistent and typically in long-standing opposition to a powerful contrary view helps explain why we respect it. And the ultimate puzzle here is, why do we respect even a wrong conscience? Because conscience is always a battle between two forces. And the people on the other side, opposed to the person who's conscientiously objecting or conscientiously providing something, have their own conscience too. Why do we defer to it? We'll get into this much more later in medical situations, with both abortion as one example and end of life. But I think we defer to it because if it's that persistent, it defines a person in their own eyes. It's part of their identity. I mean, if we take somebody like Dietrich Bonhoeffer, who in World War II, as a famous ethics professor, went back to Germany when he didn't have to, joined the resistance, and became part of an assassination plot against Hitler in 1944, and he was executed for it. He felt he could do no other. He had these beliefs about not murdering people who were just of a different religious view, in this case, Jews. He'd had those from the very beginning, and they were part of his view about a Christian ethic. And he could do no other when he saw what was happening. It defined him. I mean, who would he be in his own eyes and the eyes of the students whom he taught, etc., if he didn't stand up at that point? So we defer to it. Now, when we get to cases where we think the person who's conscientiously doing something or conscientiously objecting to something is wrong, then why do we respect that? Well, we respect that because it's part of their identity. Could get into lots of examples there. We don't defer to it completely, but we try to respect it or defer to it to some degree.
Thank you, Paul. So before we turn to our conversation specifically focused on the completed life and self-determination, let's begin by defining terms. So how would each of you define conscience? Father Don, let's start with you.
Conscience is from your heart. Conscience is something that's formed in the course of your life. Dietrich Bonhoeffer is an incredible example of that, and there are many, many others. It's not in your head. It's not some doctrine or dogma, or you must do this or you must do that. A perfect example, the Roman Catholic Church prohibits birth control. Yet, a huge percentage, well over 80 or 90% of Catholic women follow their conscience and practice birth control. That's an example of the difference between not being in your head and saying, oh, the church forbids it, I can't do this, and following your heart. your conscience and doing what's best for you, your family, planet, etc., etc.
Absolutely. And Paul, what are your thoughts?
I would define it as an individual's persistent ethical beliefs, typically in opposition to some other powerful contrary view. And the more persistent and the more reflective it is, reflective meaning we really try to examine whether we're right. The individual really tries to examine whether she or he is correct in their deep beliefs that something is ethically right. The more persistent and reflective it is, the more it's part of that person's identity. And that's how it helps explain why we respect it even when it's wrong.
So it sounds like, either definition of conscience is grounded in the sense of personal autonomy. And we'll get to that later on in the session. But I'm curious, what other ways might there be to define conscience, perhaps to play devil's advocate? What would you suggest as a few other ways to define conscience?
Yeah, I don't know that there is. What Paul said is certainly right on. I said what I said. But you see, the people who are persecuting other human beings, they don't use the word conscience. They don't say, my conscience tells me I have to persecute transgender people. They call transgender people immoral or gay people immoral. That includes clergy. That includes the whole National Orthodox Church of Serbia and a whole bunch of other things like that. So they're not talking about their conscience is telling them. They're reciting some law somewhere that these people are intrinsically evil or intrinsically disordered, or to actually call them evil, which is horrible. None of that has anything to do with conscience. Because if you follow your conscience, you can't kill another human being.
I think there are cases that don't follow that pattern. A physician, for example, who is opposed to performing an abortion. And it's a very difficult situation because the life of the mother of the woman, for example, may be endangered. And still, that physician says, I cannot do this, conscientiously objects to it. Now, whether she or he is right or wrong in that objection to performing an abortion in that particular circumstance, and there are these circumstances, and people get in a great deal of trouble about them. Sometimes when they oppose doing an abortion, object to doing an abortion, sometimes when they authorize or do it. But the person who says, I can't do that, is also acting out of conscience. Now, it might be an ill-formed conscience because it might just be a reflection of what they've been taught, and they've never really critically examined the framework in which they've been taught that. That could well be because conscience errs. I would still call it conscience if it's a persistent ethical belief formed in some attempt to be reflective, so persistent that it really becomes part of who the person is. It defines their identity.
So I have a comment about the difference between an elective abortion and an emergency. I know of no physician who would not save the life of a woman wheeled into the emergency room, bleeding from her uterus, that was going to die, that wouldn't operate on her to save her life. That's the physician's first duty. In fact, that's the duty of religion going back to the Hebrew scriptures. So that's one situation where there's no doubt whether they philosophically wouldn't do an abortion because they're Catholic or whatever, they would save that woman's life. And I'm sure that would happen. The other situation,
I'm not so sure because St. Joseph's Hospital in Phoenix in 2010, Sister Margaret, who was the supervising person there, authorized an abortion to save the life of the mother, and the hospital's connection to the Catholic Church was severed by the church. She was excommunicated. Other people at the hospital were excommunicated, and that hospital then continued to operate, or some hospitals, some Catholic hospitals operate following the Roman Catholic Church's bar on abortion, even to save the life of a mother, if that abortion is the intentional, direct killing of what the church regards as a human being with a soul already, namely the fetus.
I know this case inside out and backwards. First, it was an elective abortion to save the mother's life, not this minute while she's bleeding to death in the emergency room, which is what I said first. No physician would not save that mother's life, no matter what their belief system. This is an elective abortion, and that Catholic hospital, as with all Catholic hospitals, has an ethics committee. The woman had 3 children. She had a terrible lung disease that every doctor certified she would die if the pregnancy continued. And so the ethics committee of that hospital approved the abortion. And the point being that in those situations, the disease is the fetus. You have to take it out like a cancer or the woman dies. The same thing with an extreme blood pressure going through the roof and called eclampsia that can't be controlled with medications. The fetus is the disease and you have to take it out. Okay. Point is, if there was nothing wrong with that woman in Phoenix, if there was nothing wrong with the eclampsia patient, you wouldn't be doing an abortion. So it's a whole different situation with the totally elective versus this kind of situation. And yes, that bishop got replaced pretty quickly. He did take away the Catholic designation. He did excommunicate everybody. And just in 1 or 2 sentences, the worst case in the world was a girl raped and was pregnant with twins. That bishop wanted her to die, just like the Bishop of Phoenix said, no, let this woman die. You can't take out the fetus. Well, this young girl certainly would die. She couldn't deliver 1 baby, let alone 2, let alone carry them to term. So she rightly so had an abortion. And the bishop excommunicated everybody, the mother, the doctors, the nurses, everybody. Well, you know, that's taking something to a fanatic extreme. And that's wrong.
I couldn't agree more, but I think there are some people who do fanatical extreme things out of their own conscience.
Well, I don't think it's out of their own conscience. That's where we would disagree. I think it's out of their brainwashed belief system that what the Catholic Church says is correct. For example, in my medical society, we're debating medical aid in dying, the bill that's before our legislature. And I argued with some physicians, and when I was all done, and they had nothing further to come back with, these are 2 Catholic physicians. Well, what about redemptive suffering? Wait a minute, here's this patient dying of cancer everywhere, intractable pain. The family is suffering, watching the woman suffer. And on and on and on. From his brainwashed Roman Catholic point of view, yep, let her suffer. That's because she has sins and the suffering will aid in relieving the punishment for her sins. And if not her sins, somebody else's sins. Well, to me, that is horror story number 1 right there. Okay. Redemptive suffering has no business in any of this about medicine, medical ethics, or any of that.
So you bring up an interesting point, Father Don, and I want to probe a little bit deeper so our audience can fully understand exactly what you mean and further decide for themselves what their main takeaway is from this important point. And it really goes to the heart of religious tradition, as you mentioned, with respect to the Roman Catholic Church. And I would push you to further define the term brainwashing, because this is a term that has been, for probably for worse, but better for worse, loosely used in pop culture.
and, on the left and the right. And so to really clearly define this term, perhaps it relates to a community or inherited tradition, from one's ancestors, for example. But how would the conscience derived or informed by the Catholic Church strongly inform, perhaps to the point of personal suffering, as you mentioned, with redemptive suffering?
So that's a belief system imbued on people by the Roman Catholic Church that there is a hell, there is a purgatory, everybody's a sinner, and the redemptive suffering is for the lessening of punishment for your sins or someone else's. Well, I certainly don't agree with that at all. And the thing about brainwashing is, again, I'm big on linguistic and other programming. Pope Gregory, the so-called great, declared Mary Magdalene a prostitute. Now, every medieval artist's pictures are that way. Now, if you see enough pictures of Mary Magdalene as a prostitute, boom. Oh, yeah, she was a prostitute. Well, she wasn't, okay? It took to 1960 for the Vatican Council to say no. After 1,400 years, they finally said, no, she wasn't a prostitute. Thomas, the doubting Thomas, every artist's picture, Caravaggio being the worst, has him putting the hands in Jesus' side, but he never touches them. See, nobody bothered to read what was written. He never touches Jesus. So the point is that strikes your brain and becomes part of what you believe. And if you're taught from day one, when I was a boy, the priest used to stand up in the cross and say, your sins did that. And I would say, Mommy, what's a sin? You see, that's brainwashing. Fortunately, I got rid of most of that, but you get it jammed enough into your brain and it becomes a part of your belief system and then a part of what you do. So to me, that's what it's about, and it's really, really wrong.
So is it fair to say that once it becomes embedded within a person's psyche, it becomes it has the potential to manifest as part of their identity, and perhaps to Paul's point, develops the sense of morality, which, as you mentioned, Father Don, ought not to be as a normative standard connected directly within the definition of conscience. Paul, what are your thoughts?
Well, we have to distinguish between brainwashing, which does occur. I completely agree with Father Don, and moral education. Good moral education, whether it's in the moral tradition of a family being taught by parents or a church being taught by church, can be moral education without being brainwashing if it's not taught as the only moral view. That is, the reasons for the tradition are examined critically, and that gives the individual the freedom to depart from that tradition as they see fit. My father, who was a liberal Protestant pastor and very invested in anti-Nazi activities in the 30s and 40s, and the follow-up in the 50s, certainly gave me a lot of moral education. But he also always asked for the reasons for why I thought something after he taught something to me. And he wanted me to go to a university or a college that examined those underpinnings. And I know many people in good colleges, for sure, where I've taught, of religious traditions, and some of the religion tradition may actually be taught at that school, but it's not indoctrinated in people. It's examined. So moral education can be done without it being brainwashing. But there's always a tension there, because if you teach something too hard, or you don't teach other views equally and give them fair representation, then in effect, even though you've appeared to be morally educating, not brainwashing, it can easily fall into brainwashing, especially if all the people around the person being morally educated are of the same view. And that's where we get to the charges, counter charges about brainwashing in the current moral context, where people on both sides accuse the other side of brainwashing their adherents, even at the same time when they themselves are probably brainwashing some of their own adherents. Um, so these are very slippery terms. I would not want to get rid of the term brainwashing, but I want to use it carefully.
Indeed, and your point is well taken. I want to jump to a question from Harvey in the audience, because it's an interesting perspective on what we're talking about here, and certainly relevant to where we are in the discussion currently. He says, is conscience hardwired into humanity for evolutionary success? Is this why we are unable to deal with sociopaths who either have no conscience or are able to ignore it? How does that play in here?
I'm not qualified to answer because I'm not a student of the psychology and evolutionary processes that may be directly relevant to this question. I certainly think that there's probably an evolutionary role to moral beliefs. They may have provided stability, they may have provided a way for a society to keep what the society regarded, and perhaps were in some cases, disruptive outliers in their midst from disturbing things too much. And those societies then may have gained an evolutionary advantage. But of course, there's a great danger in that in evolutionary terms too. You get locked into a view if it's taught morally so much in a culture, it gets locked in. Then when circumstances change, and it needs to be changed, the society can't get out of it, and then it withers. I think we see that with certain cultures in the last centuries at times, and even now when we're just taking a short range historical view rather than hundreds of thousands of years view. But basically, I remain certainly on the details, agnostic on the matter.
So there's also a word called consciousness. A psychiatrist friend of mine wrote a book, and in that book he held that consciousness is part of the entire fabric of the universe. And the people who got the Nobel Prize in Physics this year, 2022, fit right in with that. They're quantum physics, talking about consciousness. So it's not consciousness we're talking about here, but it's a different step. It's a broader step. So whether an individual is imbued with a conscience or consciousness is part of the whole universe itself is a good question.
So thank you both for that. To the point of, whether certain types of thinking within society is also qualifies as brainwashing. Susan is wondering, she knows some fundamentalists who talk about faith to justify their beliefs. And perhaps this is directly to you, Father Don. Do you see that as a type of brainwashing?
Oh, so let me back up a step. I forgot one thing. The emotion associated with brainwashing is fear. So again, we have organized religions mistranslating the Bible and the Hebrew word meaning reverence for God as fear of God. They imbue and instill in you that you should fear God. Well, that's the last thing God wants. God in the Hebrew scriptures upholds the lowest of the low, widows, orphans, etc. So in order to be brainwashed, you got to be afraid of something. So Catholics grow up with the fear of hell as the dominant fear. I've been through a lot of things with dying people, with the AIDS epidemic and other things. And that fear of hell and burning in hell for all eternity is horrible. And Dante invented it. It's not in the Bible. There's no such thing. But Dante invented it. The Roman Church, they were imperial. The popes were emperors, adopted it, because what better way to control the masses? And speaking of controlling the masses, no less than the Nazi head of propaganda once said he took his lessons from the Roman Church about propaganda.
So that brings up an interesting point. Can we define conscience separate from religion? Or should we be defining conscience separate from religious sources? And perhaps both of you can discuss, non-religious sources of conscience.
Well, I think certainly conscience can be formed separate from religion, because religion is not by any means the only source of morality. In fact, I would say underneath a good religious ethic is a non-religious ethic. That is, there are reasons that transcend that religion for a good ethic within a religion. But that's another long argument. But conscience can certainly be formed separate from traditions and the context of traditions, and separate from religion. If we take a person who strongly believes, let's say a palliative care physician, who strongly believes that people should not unnecessarily suffer at the end of life when that suffering can be relieved, and who also believes that it is the prerogative of the individual suffering to say when the suffering is too much and it would be better to die. And that palliative care physician participates in medical aid in dying. That physician may not have a religious viewpoint at all, or they may be atheist or clearly agnostic in a quite self-conscious way, but they're not operating clearly out of a religious tradition. But they have a strong ethical belief that a person should not suffer unnecessarily, defined in their own sense of what suffering is too much at the end of life. Those are very strong moral beliefs that people have. If the danger in calling them moral is that we think that we're slipping into some kind of authoritarian framework above the person, around the person, then maybe we should just call them ethical beliefs, but they are strong ethical beliefs formed without a religious context.
I couldn't agree with Paul more. Obviously, there are Buddhists and Hindus and Muslims and lots of other people who form their conscience outside of what the religion says, especially the Eastern religions. And quote unquote, the Eightfold Path of Buddha is an outstanding example of exactly that, forming a conscience and doing what's right. And Buddha had the mind correct with positive and negatives. The killing of living things is not right understanding. The non-killing of living things is right understanding. And they're all like that. They're all ethical. They're moral. I'll slap myself for that word. They're ethical. They look at humanity and other creatures as all one. And they're really, truly outstanding in what they teach. Even Pope Francis acknowledged that about people being ethical who are even atheists. And we have to respect what they do to feed the hungry, give drink to the thirsty, clothe the naked, etc.
I also think it's important to keep in mind that within particular religions, there's often much greater variety than people outside that religion think there is. I mean, Father Don is a splendid example of variety within the Catholic Church, not the Roman Catholic Church, which is not his identity, but similarly certainly in Protestant circles, people will sometimes say, well, medical aid in dying is off limits because even within a Protestant tradition. But there are many Protestants and even some Protestant denominations that support the option of medical aid in dying. It's not religion may not be seen as tolerating these views that are often so strongly opposed by particular religions, but we should not stereotype a religion as many of them, at least, as harboring doctrinaire opposition to a particular thing that, out of autonomy and conscience, we want to preserve as a person's individual right. Many of them support it.
But not the Roman Catholic Church, which is very
Not
much
the Roman Church.
to the
Agreed.
medical aid and dying bill in our legislature, and they've killed it. A majority of people would vote for it in the legislature, but it won't come to the floor because the speaker is a Catholic. I want to talk about one other situation. Paul mentioned a hospice physician. There's a standard situation in medicine that no one objects to. The patient has cancer, has pain, is given a dose of morphine. They become tolerant. Dose is higher, 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 and eventually they stop breathing from the dose of morphine. That absolutely honors Aquinas's main point, intention. But when it comes to that same patient, 6 months earlier, 5 months or 3 months earlier, not having to undergo all that suffering and the increasing doses, that's when they throw the grenade. Well, in my opinion, that's incorrect. That person should have the right, and in fact does have the intrinsic right, to decide for themselves how much suffering is enough. And as a physician, my whole commitment is to end suffering. As a priest, it's the same. So I am all in favor of a person being able to end their suffering at their choice.
Indeed, and thank you for pointing that out. So as you've been talking here, I was thinking of the Harvard philosopher Michael Sandel, who has given a lecture series about what is the right thing to do, and especially related to, extracting this notion of conscience away from an inherited religious tradition. I'm curious, as we shift our conversation today towards Father Don mentioned medical aid in dying and, palliative sedation for a cancer patient suffering from unbearable pain. How does conscience connect to personal autonomy? We're threading the needle here for how this all plays together. What is the conscience of supporting self-determination and the right to die? And you may already be a few steps ahead of me. We'll be getting into conscientious objection and conscientious providing for patients. But how do we tie in conscience to the larger conversation about personal autonomy within the right to die framework?
I don't see how one could separate autonomy from conscience. An individual's conscience is part of the moral autonomy that they have. If we are to respect a patient, if we're talking about the value of autonomy in a medical context, we speak of patient autonomy. A patient's autonomy is the right to refuse life-saving treatment, among other things, and we've actually made that a legal right in our culture. And it is the right, I think, ethically, the patient, autonomous patient expressing their own views has a right to say when suffering is too much for them to bear. And then acting out of conscience to support that, if a caregiver is going to support that, that may be an act of conscience, that person, but it is because of the autonomy of the patient that it's done. And I just don't think that in many, many cases, I don't think you can separate the two. If people have autonomy, they have the right to form their own conscience and act upon it, insofar as it doesn't harm others. And then we start putting limits on acting out of conscience. But if it just clashes with opposing moral convictions, I don't think we should put many limits at all on acting out of conscience.
So part of this has to do with the concept of God as a puppeteer God. And the statement of opposition to medical aid in dying is only God can decide when you die. Well, you see, God has nothing to do with it, okay? God didn't decide that all the people who died of COVID were going to die at this point, at this time, in this hospital, da, 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 da. But that's the issue that's in what they put out there. Well, see, what they ignore is in their own religion, God gave everyone a free will. And in my opinion, philosophically and theologically and every other way, that autonomy is in fact the person's free will to make their own decisions when it comes to relief or suffering. One of my arguments to the Catholic doctors, if you hand me a gun, a guy hands me a gun and says, kill me, pull the trigger, I'm not going to do that. Okay? That's murder, or him committing suicide by me shooting him. But if somebody's laying in bed suffering, losing 50, 60, 70 pounds, the family is suffering, they're in mortal agony over the suffering of their mother, sister, etc. I'm certainly going to write the prescription that will end their suffering. And one more thing about that, there's a great deal of fear among physicians about even writing an ordinary prescription. When I'm called to see somebody in hospice or a nursing home, time and again, the doctor's order is written as needed or as requested. One person had a stroke and couldn't talk. How are they going to request it? Part of my life in recent years has been trying to get people, physicians, to write a prescription that's an ordinary dose, not a lethal dose, not medical aid in dying, just an ordinary dose of morphine, but around the clock. And to me, the brain has its own survival mechanism, we call it the animal brain, that will keep you alive no matter how you're suffering, because all it wants to do is breathe and beat your heart. So once that gets calmed by just an ordinary dose, okay, that's not going to kill anybody, patient dies quickly, within a week or two. And I've seen that too many times to even count them.
Sometimes it helps to just dissect a problem, take it apart a bit, and walk through it. I myself hold this view about assisting in a death hastened by voluntarily stopping eating and drinking. If the patient, and here's a key point, if a physician's patient has the right, the legal right, to hasten their own death by stopping eating and drinking, that is, there's no legal way that they can be force-fed. The only way they could effectively be force-fed is insertion of a feeding tube, and that is medical treatment, and they have the right, very clear right legally, to refuse that medical treatment. So if the person is refusing to eat and drink, and that's their right, and one cannot force feed them, then is the physician who assists them with palliative care to make the dying process from stopping eating and drinking more comfortable. And it can be made more comfortable by palliative care, distinctly more comfortable. Then is the physician assisting in a suicide if they help with the palliative care? Well, many think they are, and then they're reticent to help with palliative care in that situation. But they're not assisting in a suicide. They are helping the patient exercise her rights, her autonomous rights as a person to choose to die by not eating and drinking. And once a physician sees that, then they many of them tend that I've talked with, flip. They say, oh, yes, I'm not assisting in a suicide. because I'm supporting the patient's right, clear moral and legal right to do what they're doing. And that gets them out of the bind. But they still, many of them still don't want to get there. They don't want to get near that territory.
Mm.
And so, in fact, in actual practice, there's considerable difficulty in finding palliative care physicians who will support a person who voluntarily stops eating and drinking in order to hasten their death. And that's a real problem in medicine. And I think it's not, you can say, well, these physicians out of conscience won't support it. Well, wait a minute, is it well-formed conscience? Have they thought through the issue? When they do think through the issue, if they do, they tend to change their minds as long as they're not under too much pressure from their professional guild.
Mm-hmm.
So you brought up a point that raises a particularly important term: ordinary means and extraordinary means. So there are people throughout the country who are trying to push against medicine and saying a feeding tube is ordinary means. Well, wait a minute. If the person decides they stop eating and drinking, you have no right to invade their body. That's called assault and battery or whatever, to put a feeding tube in them. And that's going on. Pope Pius XII, not exactly a noted liberal, said money can be an extraordinary means. If supporting this patient who's got terminal illness will cause a severe financial hardship, you are free not to do it. Nothing has changed. John Paul II famously said, don't take me to a Catholic hospital. I don't know if he said that or not. What I do know is somebody put out something in his name which made a feeding tube ordinary means. Well, he never did that. And eventually that document was never found again, and nobody can find it. And the Catholic medical ethics stand from the time of Pius XII or even before. A feeding tube is extraordinary means. The same group of, I don't know what to call them, that want to make everything ordinary, including brain death. Oh, wait a minute. You got a flat line on the, oh, you're not really dead. That's just a test that showed, well, guess what? That's the medical definition. And they're trying to even change that. So that stuff's going on in our world. And anyway, just to call people's attention to it.
Certainly, and I appreciate you mentioning that. I think this is a good point in our conversation to pivot to really focusing on the conscientious objection of providers of aid in dying, and the implications of conscience for MAID within states where it's legal, and also for future providers potentially of MAID in states where legislation is being considered, such as New York and other states. Important to note is that for a patient who qualifies for medical aid in dying, meets the 6-month terminal prognosis criteria, is of sound mind, and resides in a state where MAID is legal. The exception notably is the state of Oregon, which yesterday's session 1 focused on heavily. So I encourage you to watch the recording of that if you missed it. But importantly, physicians are not required to refer to MAID providers. That's not embedded within the requirements. So let's talk about this. I firmly believe that, in healthcare, we should recognize and respect conscientious providers as readily as we do conscientious objectors. And this term of conscientious provider is something that our colleague, Dr. Sandy Bookman, up in Canada, who was on the session 2 of yesterday's program, he introduced to the completed life stage. So I want to acknowledge him for that. So what are your thoughts on this? How do we resolve and reconcile conscience when a provider is objecting and yet a patient clearly qualifies? how do we resolve that tension?
Well, the standard compromise, although it's not, interestingly, it's not been put into the legislation legalizing medical aid in dying in the states that have legalized it in the US. The standard compromise is to allow providers to refuse to participate, but require referral. This is an imperfect solution, however. First of all, there may not be willing providers available, so there's nobody to refer to. Secondly, to the person objecting, the conscientious objector to participating, referring still seems like complicity in the act that one refuses to do oneself. So the person says, I conscientiously refuse to refer because that would make me complicit in the deed that I regard as immoral. But in certain situations, I think we should require referral. And then the question becomes, well, if we do require it, but there's no other willing provider that the physician or nurse can refer the patient to, then should they nonetheless have to do it themselves? That's a real bind. We haven't approached it in medical aid in dying because we don't even require referral. But in my view, if the state has said this is legal, it's morally, and the culture has said this is morally permissible, medical aid in dying, then if you object to it yourself as a physician, you should refer. And we should go to some real effort to make sure that there are people to whom the patient can be referred. But that's a long, difficult, just medical availability issue.
Yeah, I don't think it is. So first of all, a physician has the right to refuse to do an abortion. Okay, that's fine. But a patient can find somebody to do an abortion easily enough. All you have to go to an emergency room. A physician has the right to refuse writing the prescription for end-of-life care. But that physician does not have the right to make a moral judgment about that patient in front of him. His job, or her job, either one, as a physician, usually it's a him, is to refer the patient. Now, yeah, there's areas in the country where that may be difficult, but as things open up, people from one state may be able to go to another. In my state, there's no difficulty at all, okay? There are people who, in fact, won't participate. Okay, fine, that's their right, physicians. But there's plenty of people everywhere, and all they got to do is call the medical society, okay? And so the medical society can easily provide people who are willing to participate in that. So I think that's that the
Even
people,
in California, that's not true in certain areas. Even in
yes, I
California,
understand
it's not true.
that there are, you know, scattered people here and there, but they can travel or they can somehow get to where somebody can do it. Okay. I think that you're making this a monster issue when it's not that it's a zero issue, but it's a minor issue compared to the general population.
But I think it's really interesting that in writing the medical aid in dying laws, the laws legalizing medical aid in dying in the 10 states that have legalized it, actually not all of those are by statute, but where it is by statute, it has not been put into the law that physicians who object must refer. They don't even have to try to refer. They're not legally required even to try to refer. And in my view, that's wrong. If we as a society say it's legal and patients have a right to it, if they're eligible, fitting within the eligibility criteria that the law itself states, then medical providers should be obligated to refer. Not just morally obligated, but they should be legally obligated.
Indeed. And incentivized to refer as an obligation of their treatment and caretaking of the patient. I just wanted to offer a clarification to something Father Don said, because we're getting some questions about the comment about a person can get an abortion anywhere. That would only be true for a person to go to an emergency room in a state where abortion is legal, given the aftermath of the Dobbs decision.
Right.
And unfortunately, in states like Texas, it's much more restrictive.
Sorry, I didn't clarify that. My mistake. I should have, and I just repressed that these states could make such outrageous laws.
So I want to make sure that we have time to answer questions coming in from the audience, and thank you all for those of you who have already submitted your excellent questions, and keep them coming. We want to make sure that we address as much as we can with the time that we have today. But I also want to offer Father Donna and Paul, given that we've arrived at this point in the conversation, looking at the future of self-determination within, the United States, it's still quite limited. Of course, as Paul, I'm sure will know, voluntarily stopping eating and drinking is legal in all states, whereas MAID is not. It's only legal in a fifth of the states. And so as we're looking at this, at growing momentum for the right to die within the United States, and issues with conscientious objection, lack of mandatory referrals, where do you see conversations with perhaps regard to Catholic providers in the Catholic Church within the states, and other objections? Where do you see that playing out within the U.S.?
I don't know where Catholic providers are going to go with this, whether there will be considerable liberalization within their ranks or not. I do think that on the whole national stage, Canada is going to be a really important comparison. We had an interesting program on it yesterday, and I think that though many people do not know about how Canada has worked its liberalization of medical aid in dying, and by the way, they use the term medical aid in dying not just for self-administered aid in dying, as in the U.S. legalized states, but for euthanasia, what we would call euthanasia as well, that is physician-administered lethal aid in dying.
Well, and even on that point, self-administration is the rare.
Yes, and
Current
self-administration is
in
rarely
Canada.
chosen there when people have the option of physician administering it, for good reason, because physicians are not going to make mistakes in the final administration, which is what self-administration can lead to. But at any rate, I think that it's entirely possible that before 20, as distinct from the current 10 states, legalize self-administered medical aid in dying, there will be one state or more that will legalize what we call euthanasia, or physician-administered medical aid in dying. I don't know what that state will be. I know it's being discussed in New Hampshire, for one thing, one example. But I would think that in a state that is very open already to, or has legalized medical aid in dying, self-administered, the U.S., typical U.S. example, that there will be a state that legalizes physician-administered aid in dying. That is the Canadian sense of MAID.
I just want to put out a language change. The opposition to medical aid in dying here has had a bludgeon with the words physician-assisted suicide. We finally got that taken out of the medical society's terminology. And now they are informed neutrality. And I would like to get rid of the term euthanasia forever, because that's been used with Hitler. Okay, it strikes the mind the wrong way. It's physician-assisted medical aid in dying, or physician-administered medical aid in dying. That's the term we should be using.
Well, philosophically, the discussion has been rife for centuries about this, and there have been many, many defenders in philosophical circles of euthanasia. But it absolutely does have the ring you call attention to, Don. And probably the better course to take, just in speaking, is to call it physician-assisted dying. Whether it's self-administered or whether it's actually done by the physician, it is physician-assisted dying. And physician-administered dying is clearly physician-assisted dying.
Right.
So let's adopt the Canadian, I hope we gravitate toward the Canadian convention of seeing medical aid in dying as including physician-administered, not just physician-assisted.
Certainly. But we have a long road ahead of us. So hopefully that
Just
With-
keep hammering away. We've got to keep hammering away. I mean, that's part of the autonomy of people who want to do this and believe they have the right to do it. Their conscience says keep hammering away on this. Another comment I would make is about providers and doers, not just objectors being within the umbrella of conscience. Doing something on the basis of conscience should be respected as much as not doing something, as long as it doesn't harm others. And we have so deeply ingrained in certain moral views that there's a distinction between allowing something to happen by not doing something to stop it, that is, by not administering life-saving care, for example. That can be done, and one can fail to save a person, and that is much more allowable than ever deliberately causing the end result by action. And I just don't think that action, non-action distinction holds up morally. But that's another long, and I think it's eroding in our, slowly eroding in our culture.
So I'd like to turn to a comment that Kate put into the Q&A box. She writes, conscience in my native Japanese language writes good heart. Defining conscience seems to depend on how to define what is good in our heart for humanity, such as a quality of uplifting, nurturing, supporting, healing one another. The church's moral quote unquote sin seems to have been using the words conscience or sin in punitive manipulation, while missing the point of what goodness for humanity meant to be. One of the meanings of sin in the original biblical language is missing the point. Perhaps, Father Don, I invite your commentary on this.
So the person I mentioned who was the Episcopal priest who was a Jungian scholar and also a scripture scholar, coined the term linguistic barbarism. And linguistic barbarism, among others, is putting modern words back into the first century where they did not exist, like the word homosexual, which did not come into English till the 19th century, or the word Jew, which did not come into English till the 12th century. Those are all deliberate religious and hierarchical back insertions. So is the word sin. And I invite all the people I teach to never use the word sin, but the original term is an archery term, meaning to miss the mark. The person who wrote that is correct, except I would add that one word. So listen, there's no written gospels, no written Hebrew scriptures. You're trying to pass something on to your children. What better way than an archery term? Everybody knew what that was back then. You know, you shoot the arrow and it either goes off the path or you miss the mark. And Isaiah has God saying, I will make a road wide enough even for idiots and imbeciles. And so that whole notion of missing the path to God, and by the way, the theological definition of sin is being separated from God, not some horrible stuff that's taught to us. And so the bottom line is, what a benign thing now. Everybody misses the mark, but we're not dirty, no good, rotten sinners that are going to burn in hell.
Indeed. And to Marcia's point, she says we also need to try to get rid of the use of the word suicide in relation to a person's rational decision to end their life due to a condition that is producing irremediable suffering. And I would add, regardless of a terminal diagnosis or prognosis, but you can have irremediable suffering without that terminal criterion. Paul, would you like to jump in here?
Well, it depends what hat I have on in my reaction to this. If I put on a certain kind of linguistic hat here, and what is the definition of suicide? The definition of suicide, as long as we don't make it a normative term, where to be suicide, it has to be something wrong or foolish. If we just define it technically as self-administered intentional death, then medical aid in dying, either self-chosen or self-administered, both, is suicide, technically. But of course, in the language in which we've come to talk so so importantly about suicide in our culture, suicide is an act of passion, often usually irrational. It's impulsive. It's often violent. And so the meaning of suicide becomes something pejorative. The normative badness of it gets built into the very term. That's just one way in which language has shifted. It's no longer, suicide doesn't just mean technically intentional self-administered dying. It means this other impulsive, often violent act that we should never assist and try to stop when we can. And I think that it's entirely appropriate to excise the term physician-assisted suicide from the medical aid in dying discussion because of that overtone. Let's not be tricked by words here in the moral opinions we form about medical aid in dying. So let's just call it medical aid in dying. It is aid in dying. It's not misleading to call it aid in dying. So let's call it medical aid in dying.
And I go back to Aquinas. The number one criteria, condition, is intention. If the person comes up to him with the gun and says, pull the trigger, nope, I'm not going to do it. But here's the person lying in bed, they and their family are suffering. My intention is to relieve this suffering. That triumphs everything, okay? If they weren't in that condition, would they come up and ask me for the prescription? Heck no, they wouldn't, okay? That's what the blinders are on the opponents. Oh, you're killing it. No, if they didn't have terminal cancer or whatever, then they wouldn't ask for the prescription and I wouldn't write it, even if they did. But now they do have terminal cancer. They are suffering. The family's in agony watching them suffer. And I'm treating the whole family by my intention, which is to relieve their suffering.
So there's a follow-up question from Kay. She contextualizes it within the discussion of self-determination and the right to die. It sounds a little binary. Whether to support their request or not, or whether to object to their request or not. Behind each, and she goes on to say that behind each different person's expression is an ocean of thoughts, feelings, and needs with lots of ambiguous areas which need compassionate support for the person to see that life's potential and choices regarding unseen meanings of fulfilling life. So how can we support such, as she says, transformative potential while making all choices available, fully attending to that person's process as well?
Well, we need frank conversation about these matters in lots of different circles. And if we get closest to the ground here, the circles are between a patient and a physician, between a person slash patient and their family, and among their family. We need to talk about it, to demystify it, and to share misgivings as well as support. We also need to recognize that support takes various forms. I can support a person's decision to choose to end their life because it's their right and I respect their autonomy. But that doesn't mean necessarily that I thought it was the right thing for them to do. Or I may think that it is also the right thing for them to do given their mental situation and framework, but it wouldn't be the right thing for me to do if I were in their situation. We just have to be just honest and sharing about these things. I'm encouraged that when my wife and I moved to California 7 years ago, one of the early things that our primary care physician that we got when we came here asked is to have a conversation about end of life matters. I mean, we weren't that old, but we were old. And she just made very, very clear that she was open to that conversation. And if we had an advance directive, she wanted to know what it was. And we haven't had lengthy conversations because we think we already have an understanding whether given other communications. But I think sometimes the reticence is on the part of patients and family members. It's not always on the part of providers. The providers may often be more willing to have this discussion than the people are.
Thank you, Paul. Father Michael Nicosia writes that we ask patients to engage in conversation with providers and others invested in their care when making decisions. There seems to be an ethical gap if a provider blanketly conscientiously objects to providing care without engaging in conversations with the patient that could impact their decision to provide care or not. So, what obligations are care providers under if a patient has a desire for medical aid in dying under certain circumstances spelled out in their advanced care planning?
I think the provider's obligation is to do what the patient, what's best for the patient. If the provider wants to be all the conscientious objector they want, the fact is, again, I'm all for finding someone who will look at the patient. Now, again, see, practically nobody will refuse a patient signing a do not resuscitate order. This is somebody alive and well, 25 years old, 30 years old, and they sign it, okay? They don't want to be resuscitated no matter what. Okay, fine. I don't think most providers or any provider I never met one would object to that. There are people trying to overturn that, but not providers. So then the next step and the next step and the next step, I would ask the provider, and we will have conversations at our medical side about this. Okay, you're not objecting to a do not resuscitate order. What's the difference between that patient's right to choose not to be resuscitated and their right to choose the time and place of their death if they're suffering from a terminal illness?
And here we do have a linguistic problem because the Hippocratic Oath is interpreted to say, first do no harm. And then that shifts into above all do no harm. And then causing death is seen as harm. But wait, in certain situations, causing death is good. It depends on whether death at the time or a prolonged death is bad and a sooner death is good. So, the easy path for people who aren't thinking about this is to say, well, a physician's obligation is above all to do no harm, and therefore we must be healers, not killers, which just completely grossly oversimplifies the issues.
To me, first do no harm means do not allow the person to suffer. Your job when you raised your right hand, and I'm Hippocrates talking, when you took my oath was to relieve suffering. The first do no harm in terms of that patient's body, mind, and spirit.
I wish it were understood that way uniformly.
Well, but see, people seize on to stuff that's not meant to be that way, and they use it as a bludgeon.
So, related to that point, Ali asks, will the Roman Catholic Church ever redefine terms like redemptive suffering to potentially open the door for the possibility of accepting autonomy around end of life? The world seems to move slowly towards accepting medical aid in dying. So will religious institutions keep up with changing public opinions?
2 points. Some Roman Catholic priests who are friends who I know, like Father Richard Rohr, write about institutional evil. And they say that all these years, the Roman Church has emphasized sin and individual sin, but they've ignored institutional evil. And popes can do no wrong. So after centuries, Galileo was absolved of heresy, but Pope John Paul II never said the Pope who condemned his heresy, which is the earth revolves around the sun, he never said he was wrong. When Pope Francis just went to Canada, the Pope Alexander VI, who promulgated the doctrine of discovery, did it. Pope Francis himself said, oh, Catholics did evil, blah, blah, blah. He never would condemn another pope, no matter how evil. He never would condemn Alexander VI, who instituted the doctrine of discovery, which made indigenous peoples less than white Europeans, able and blessed them conquering the country of those people and pushing them down into oblivion. So that's the problem with the institution. To answer the question, no, the institutional church will never change. And wide swaths of it are changing. There are thousands of independent Catholic communities who like what this fellow Jesus had to teach and had to say, okay? But not what the institutional church committed linguistic barbarism and said that he said, or said that he meant, or said that it's his will. I mean, it's very clear. God says, my will is this. I want you to go forth in joy and happiness. Let the mountains and the hills sing before you, and the trees of the forest clap their hands. Well, it doesn't get any better than that. That's God talking.
Thank you. So last question, and then unfortunately we are out of time for today. Comes from Deb. She's wondering, could you discuss conscience in terms of restraint from action, for example, do not resuscitate DNR order, versus agency to act, for example, proportional sedation or even medically assisted dying?
I think I've said before that I think one can conscientiously do things, not just conscientiously refrain from things or object to them. And I just think the role of conscience is not limited whatsoever to objecting or to refraining from doing things. It also plays an important role in leading people to say, even when there are professional or cultural barriers to my supporting this view or doing it, I'm going to do it. And I celebrate people who act out of that conscience. And I think Dr. Bookman's identification of himself as a conscientious provider in the Canadian context of what there is called track 1 medical aid in dying patients, though a conscientious objector to patients, or at least hesitant semi-objector to hesitant person on track 2 patients. I think that was just a splendid example of how he could be strongly a provider of certain things out of conscience.
Indeed, indeed. All right. Well, this morning flew by. Thank you both so much for your time and insight and wisdom. So I invite each of you to conclude with a closing remark as a main takeaway that you'd like our audience to hold with them as they leave the session. So Father Don, I'll start with you and then over to Paul.
Yes, and I'm going to quote Pope John Paul I again. Never be afraid to stand up for what is right, whether your adversary be your parent, your teacher, your peer, your politician, your preacher, your constitution, and I will add your religion, your bishop, or your pope.
Thank you. And Paul?
Well, an historically famous phrase, here I stand, I can do no other.
Oh, wow. Thank you both so much. This was incredible. And thank you all in the audience for tuning in today and submitting some excellent questions. So stay on this call if you'd like to join this afternoon session, which starts at 1 p.m. Eastern Time. Cultural considerations about good deaths with Dee Dee Sanchez and Hannah Fowler. And if you're new to the Completed Life event programming stage, feel free to check out other items on our website, such as our video archives from past events, our Completed Life journal, our podcast, Voices of the Completed Life. And don't forget to tag us on social media as well. We'd love to connect with you. So this event will be posted. The recording will be available starting next week on our website and also emailed to you if you are subscribed to our mailing list. So with that, I thank you all again so much and wish you a wonderful rest of your day and look forward to welcoming you back this afternoon in about 30 minutes for the next session. See you soon.